India's capital, New Delhi, will extend its week-long lockdown as the country's Covid-19 crisis grows, with infections and deaths hitting new record highs. New Delhi Chief Minister Arvind Kejriwal says that the decision for the extension was because the havoc of the coronavirus continues and there is no respite. The Kenya High Commission in New Delhi has asked Kenyans living in the locked-down capital of India to register with the Commission for Accountability and Decision-Making Process. Kenya says that this is born out of India's decision to institute measures to assist in slowing down the rate of infections.
India's daily coronavirus death toll set a new record Saturday as the government battled to get oxygen to hospitals overwhelmed by the hundreds of thousands of new daily cases. 20 patients died in one night at one New Delhi hospital suffering from oxygen shortages, medical officials have said. A Delhi court said that the new pandemic wave had become a tsunami. Queues of COVID-19 patients and their fearful relatives were growing outside hospitals in major cities across India, the world's new pandemic hotspot, which has now reported nearly 1 million new cases in 3 days. Another 2,624 deaths were reported in 24 hours, taking the official toll to nearly 190,000 since the pandemic began. More than 340,000 new cases were also reported, taking India's total to 16.5 million, second only to the United States. But many experts are predicting the current wave will not peak for at least 3 weeks and that the real death toll and case count are much higher. Germany and Kuwait on Saturday followed the United Arab Emirates, Britain and New Zealand in restricting travel from the country. Kenya, which has tens of thousands of its citizens living and working in India, has asked its citizens to register with the embassy just in case Kenya needs to make a decision on how to help its people, as the current wave in the Indian capital continues to ravage the nation. Kenya's ambassador to India, Willie Bett, has asked Kenyans to give details of their passports, contact addresses, telephone, email and physical locations and purpose of being in the country to enable movement back to Kenya just in case this is possible. Indian Health Ministry data showed nearly 315,000 new infections in the past 24 hours, the most any country has recorded in a day since the pandemic began, as hospitals sent out desperate warnings that patients could die without fresh oxygen supplies. A key question is whether a new variant with potentially worrying mutations, B.1.617, is behind what is currently the world's fastest growing outbreak, or whether it is being driven by human behavior like super spreader events such as huge religious festivals and political rallies with mostly maskless crowds. The B.1.617 variant has already appeared elsewhere, including in the United States, Australia, Israel and Singapore, and on Thursday evening Belgium authorities confirmed it had been also detected there in a group of Indian nursing students who arrived earlier this month from Paris. With the global death toll now standing at over 3 million, Europe has also recently been hammered by a ferocious surge in new infections. Nevertheless, cautious hopes are being voiced that the worst of the region's third wave could now have passed. In France, which is currently under its third coronavirus lockdown, with most non-essential shops closed, Prime Minister Jean Castex said there had been a genuine fall in the circulation of the virus over the last 10 days. He announced that from May 3rd, France will drop restrictions confining people to a 10-kilometer radius of their homes, and that cafes, restaurants and cultural venues closed since October could begin to reopen around mid-May, depending on the evolution of the health situation. Vaccination programs that started very sluggishly in many European countries are beginning to pick up their speed.